After you have successfully set up your blood pressure device, you may be wondering, how often should I measure my vitals? In this video, I will walk you through why measuring your blood pressure matters, how often to check your blood pressure, and what are the goals for your blood pressure. Measuring our blood pressure is important because it can help to detect blood pressure variability. Some people have different morning and evening patterns. With both morning and evening readings, we can help to investigate the potential reasons why. In addition, we can understand daily fluctuations due to factors like nutrition, physical activity, and stress. It can also help to identify white coat hypertension, which is elevated blood pressure in a clinical setting such as your doctor's office. Also, masked hypertension, which is elevated blood pressure or high blood pressure at home. Measuring our blood pressure is also important because it can help with early detection of issues and will also enable the tailoring of your treatment plan. Next, we'll look at how often you should check your blood pressure. Ideally, patients with hypertension should measure their paired blood pressure at the same time each day, including in the mornings and evenings. Paired blood pressure readings involve taking two separate measurements 3 minutes apart to accurately monitor and understand the fluctuations in blood pressure. However, for several different reasons, some patients may need to check their blood pressure more or less often, and so we recommend to measure your blood pressure for a minimum of at least 3 days per week. This includes the paired blood pressure readings for clinically meaningful data. Next, we'll look at understanding your goals for blood pressure. These goals will depend on your baseline or where you started. Your blood pressure goal will depend on your unique health factors. So, for example, people with other chronic conditions or older persons may have slightly different blood pressure goals. For most people, research shows that persons with hypertension should first try to lower their blood pressure to less than 140 over 90. And then once this goal is reached, further decrease blood pressure to less than 130 over 80, and so forth until we reach the normal range, which is a blood pressure being less than 120 over 80. If you're not sure about your goal, you can always feel free to work with your care team or your doctor to develop a more personalized goal. And that's it. Thank you so much for taking the time to watch this video. I hope that it was helpful.